when you're going and healthcare, and this is kind of what Texas Best Docs is all about, is, the families and the kids being front and center and how they feel when they're with their doctor and how you make them feel. It's really important. And as a parent, you're scared when you're coming in and you're not sure what's going on with your child, knowing and putting your trust in somebody. What do you think that's super important, obviously, but having the family be able to trust you, how does that make you feel when they come back and they're like, oh, we just can't go anywhere else?
Well, I think it's such an honor and it's such a privilege, and I don't take that lightly. And especially being a parent myself, like putting that trust into somebody to, help you make good decisions about your child. We are inundated with information every day, right? As parents, we see all kinds of articles that maybe give us conflicting information. So I think to have a medical home for your child where you feel like you can communicate effectively with, your child's medical team and be able to trust their advice, that is so important. Otherwise, it's a very confusing world out there.
Yeah, and a lot's changed in the medical field. From this side of the table to your side of the table since COVID. Do you have any advice for parents or anything that you would tell them for, handling not only their healthcare, but their children's?
Yep. So, I think if you can ever meet with your, provider, especially when you are choosing a pediatrician, a lot of pediatricians will offer just consultation appointments before you start to kind of become patients at their practice. If you can meet with your doctor ahead of time and kind of get a sense of what their communication style is, do you feel comfortable asking questions? Do they align with you on your philosophies? I very much think it's a partnership. When you are in a patient-doctor relationship, it's not that the doctor tells you what to do because they know better. They need to understand where you're coming from, what your concerns are. They need to listen to you. You need to feel heard, and you need to feel confident that they're, giving you advice that you can trust.
Yeah, and that kind of leads into one of our main topics for the podcast today is going to be healthcare transparency. And why do you believe that in today's medical field that transparency really should be the most important?
Right. I think we, as on the patient side of things, need to be able to make good decisions for ourselves and for our health. And we need to be able to have access to the information that we need to make sure that, we feel comfortable and feel, that the providers that we're trusting our care to are going to do the right thing for us. And I think part of it also just goes down to having so much information at our fingertips that we can almost kind of drown in it, so to have like a concise way of knowing, who you can trust and whether there's, concerns that you need to be aware of as a patient, that's very important.
Yeah. And because you're not only a doctor, you're also a mom. So being able to have the tools are obviously in it. So, a lot more people than maybe the average Joe like myself. Yeah. But being able to have that tool to be able to utilize it, right, it's got to be big.
Right. And that's huge, and I think about, my parents as they get older and maybe need more doctors for themselves or more specialists that maybe I don't, know as well. I would really want to be sure I could trust that person's advice.
Yeah. And, we talked a little bit before the podcast that as a doctor with littles, okay, what kind of questions do you wish that parents would maybe ask you, or maybe they don't know to ask, but some things that they should ask if they go to somebody that maybe isn't you?
So I think one important thing is, how do I get in touch with you when I have a question? I don't think that, you should have to wait till you're at your appointment to have all of your questions, although I welcome that. I love lists. So I love when people have their lists. But, if you have a question that comes up in between, what are the ways that I can get in touch with you? What if it's an emergency? How do I reach your office? And then just from a medical care standpoint, I'm big on development. I'm big on early childhood development. And so one thing I start with, even from the newborn stage, is, hey, how can we set our baby up for for success. Let's do some things right from the beginning that maybe foster, good bonds with parents and foster good, communication and language development and, physical development. And I think that's something that, is definitely a fair question to ask your doctor is, hey, how can I, maybe set my baby up for success developmentally? What can I do preventatively? What can I do to maybe think about them in the future, not just the immediate issues that we're in here for now?
Yeah, those are some really good points, because I know you would always give like the
Mm-hmm.
booklet with all the information for me, because I need to visually look at things.